Okay. Hey, thanks for coming in, Mr. Ibarra, today. We just wanted to have you come in so we can talk about some of the stuff that the doctors found. Since we've been monitoring your blood pressures and keeping a log, the blood pressure's been a little high the whole time. So we're going to go ahead and start you on some high blood pressure medicine. With your other risk factors that you have, so since you're 47 and your dad had cardiovascular disease and when he was in his 50s, we think you're at high risk for developing cardiovascular disease, and plus you smoke as well. So these are going to put you at risk for cardiovascular disease, okay? So I wanted to talk to you about that today and then tell you what we're going to kind of do about it, okay? So cardiovascular disease is when your arteries narrow and the blood vessels thicken in the arterial wall, okay? And that causes reduced blood flow to the tissues and organs. And so plaques can form from the cholesterol, and the narrowed vessels, they can break off and rupture the plaques, and the blood clots can block the blood flow to your heart and brain, and that can result in a heart attack or stroke, okay? So what we're going to do is some preventative measures as well, so that you will not, hopefully, end up getting a heart attack or a stroke in the future, okay? So we're going to go ahead and place you on aspirin therapy, and that helps reduce blood clots. So we're going to have you take that every day, and it's going to be a low-dose aspirin, and it can help prevent the development of cardiovascular disease as well. So what we're going to have you take it every day, and while you're taking it, I want you to watch for bleeding, because it is a blood thinner. So the main thing is gastrointestinal bleeding, which is blood in your gastrointestinal tract. So if you start having bowel movements or something like that that has blood in your stool, then we want you to let us know, so we need to change things, okay? And we're going to start with the aspirin at first. We're also going to start you on a called a statin medication. It's called atorvastatin, and it's to help keep your cholesterol low. So your cholesterol numbers are good right now. We just want them to stay that way. Okay, so this is more preventative than anything. So this atorvastatin is going to help keep your good cholesterol high, which is the HDL, and then your LDL, which is your bad cholesterol, low. Okay, so that's going to keep that cholesterol from accumulating in your blood vessels as well, so that because that can contribute to the formation of plaque in your artery walls. Okay. The plaques can break away, like I said, and cause you to have a heart attack or stroke. So we want you to go ahead and start taking that. It's going to be in once-a-day medication. Okay. We want you to let us know if you start feeling like any liver problems, which would be yellowing in the eyes and things like that, because the atorvastatin can cause you to have some liver problems, injury to your muscles, and kidney dysfunction. But we're going to monitor your labs periodically to make sure that those are okay, because that's how we can tell if your liver and everything's okay with those lab work that we'll do. Okay. So with your high blood pressure, that's another factor that's going to put you at risk for cardiovascular disease or heart attack or stroke. So we're going to go ahead and start you on the blood pressure medication. What we're going to do is start you on a combination therapy. So it's going to be a blood pressure medication with a diuretic together in one pill, so you just have to take one pill. Okay, so it's going to be once a day, and it's going to be called, it's Ramperil, it's a blood pressure medication, and it's to decrease your blood pressure, and your hydrochlorothiazide is a diuretic. That's going to help decrease your sodium in the body, so that that'll help decrease your blood pressure. So you're going to be started on 2.5 milligrams of Ramperil a day for a week, and then we're going to increase it to 10 milligrams, and then the hydrochlorothiazide is going to be 12.5 milligrams, just consistently. So you'll take that every day, and then we'll have you come back in a month and check your blood pressure and see how you're doing. One of the things that we want you to watch for is persistent cough, a dry cough that can happen from this type of medication. So I want you to let us know if that happens, okay?
Okay.
Just watch for any, taking any potassium supplements, or avoiding potassium containing salt substitutes, because it has a tendency to have you retain potassium. So, but with the hydrochlorothiazide, I think you'll be okay. Okay?
Okay.
So we're gonna have you monitor your blood pressure. There's just a few lifestyle changes we're gonna recommend. So the first one is quitting smoking. That's one of the main ones. Smoking causes harm to pretty much all organs in the body. We want you to try maybe counseling and a nicotine patch to start with. If that doesn't work, we might start you on Chantix, which is a medication that can help you quit smoking.
Okay.
So we're going to give you a couple resources for that. You can go to smokefree.gov, and that gives you some resources for quitting smoking. And the other one is 1-800-QUIT-NOW, and that's a number you can call, and that's where they can give you some help as well. Since you smoke, that does, increases your risk of developing the cardiovascular disease and also lung cancer. So that's the main one. We want you to go ahead and try to stop smoking. If you quit smoking, it cuts your cardiovascular risks in just 1 year. So your risk for an MI drops pretty quickly. And also your risk for a stroke after stop smoking decreases in 2 to 5 years. Okay, so that can help as well. We want you to probably also start exercising a little bit. So just try to exercise about 2.5 hours a week. You can start with like 10 minutes a day and increase it as you go. So you can work up to the 2.5 hours a week. The physical activity will help a lot. If you lose just 10 pounds, you can lower your risk of heart disease as well. We also want you to modify your diet. So cutting down on saturated fats, fatty meats, and high fat dairy products. Cutting down on the salt as well. And increase your fiber intake with vegetables, fruits, and beans, and whole grains. So do you eat a lot of Hispanic foods?
Yeah.
Okay, so you're unfortunately going to have to maybe try to modify some of those things. Modify, instead of flour tortillas, have whole wheat or corn tortillas. Try to decrease the cheese, low-fat cheese, or decrease dairy milk, low-fat milk. Eat avocados, vegetables like peppers, tomatoes, yams, and eat grilled lean meats like fish or chicken. And try to have brown rice instead of white rice, and use corn oil or olive oil if you need to. And just avoid using butter for cooking, and lard as well. Okay? Snack on nuts and unsalted nuts, and that might help as well. Okay, so hopefully we'll see you back in a month, and we'll just recheck everything then.
Sounds good. Thank you.
You're welcome.